And Tony, how are you going to facilitate the integration that Terry spoke about earlier between the acute sector and the primary care sectors that look at a holistic approach to delivering health outcomes?
Yeah, look, I think it's a real risk. The National Health Reform Agreement is a public hospital funding agreement. There are other agreements that you know of, and many people in this room work in programs funded by other Commonwealth agreements that aren't hospital agreements. But the National Health Reform Agreement is a hospital funding agreement. That's why I've got this terrible job of trying to define what a hospital service is. The risk in that is we get it wrong. It's too narrow, so people get admitted for unnecessary reasons. Or if it's too broad, the Commonwealth pays for things they've never paid for before. So we're trying to strike a balance between those two risks, if you like. So there is an inherent risk in this discussion today that will inappropriately incentivise admission or recategorisation of hospitals, of services back into the hospital realm. So we're aware of that risk. We're trying to define our scope so that it is reasonable and is clinically appropriate and contemporary. We've already defined a number of services that go well outside the hospital boundaries, so hospital in the home programs, mental health outreach programs, etc., etc. Community palliative care, the Commonwealth say it's out, we say it's in. You know, these sorts of things are in active discussion right now, but our basic principle has been to drive a contemporary model of care and not to disrupt the development of models of care around the country that are community